Sawasdee krab, and welcome to ASEAN Connect. The Thai-Myanmar border in the past decades have faced prolonged series of conflicts between the government and the minority groups. And as Myanmar begins the process of unity, the situation is now being resolved towards a positive direction. At the time of chaos along the border in Masot district of Tak province, a story of a woman who has dedicated her life for others unfolds. It is the story of Dr.Cynthia, praised as the woman of kindness by many whose lives she has saved. This is Dr. Cynthia, a Burmese doctor of Karen ethnicity, 55 years of age. She has graduated from the Yangon University, and with the political situation in Myanmar in 1988, a large group of students had fled into the forest by the Thai-Myanmar border. Instead of choosing to be a doctor in her own country, Dr. Cynthia decided to take refuge in Masot district, Tak province, and opened the clinic with support from international human rights organization.
Medical clinic established in 1989, just after 88, the democracy movement in Burma. So I myself and thousands of civilians and students fled to the border. So we started like as an emergency medical relief and program and start coordinate with the border community like Karen Department of Health and Welfare or Mesa Hospital to establish an emergency medical center. So in the early day, most of our patients are the new arrival who fled to the border during 88 uprising in Burma.
From an old wooden building, Matao Clinic has now expanded into a small hospital of 200 beds. The clinic does not only care for those suffering from war-related injuries, but also for Karens who are ill and impoverished, traveling far and difficult distances to receive treatment here free of charge.
So we need to train more volunteers. So we start to training and we try to help or to establish a local. Each student camp, we start establish the health center for the displaced people, new arrival. And again, we coordinate with the Mesa Hospital or other local Thai supporter, the community leaders, to access referral services or to access some medical supply from Thailand. So this is like a coordination center for Thailand service and in Burma service.
As the conflicts in Myanmar resolved, Masot district of Tak province, located across a current state, Mewadi in Myanmar, has become a border economic area that grows rapidly. A large number of Karen labor migrated into Masot for work. It is estimated that there are no less than 100,000 workers, both registered and unregistered under the Thai law. Currently, patients at Matao Clinic are no longer those affected by war, but rather those in search of a better healthcare system, of course, for both legal and illegal migrant workers. This is an issue in the healthcare system of Thailand, including a small hospital like Matao.
There are many other migrant workers who cannot access services or difficult to access services in Mesa Hospital because they don't speak the language or there is the cost for the treatment. So we start treat. They come to us. So we start treat like outpatient care, basic medical service initially, and then we see that there are more and more people learn about the health services and they come to us.
Not only does the hospital have to provide health services to migrant workers working in Massaud, but also to provide service to people crossing the border from Myawaddy. This is a challenge for the Metta Clinic to increase their capacity to meet the needs of patients that is increasing every year.
Since 1995, there is increasing cases treating at the clinic, and every year 10 to 15% increase. So today we have almost 150,000 visits, client visits a year, and we have 200 beds in patient facility, including maternal child health and medical surgical department, as well as we also have some rehabilitation center for like amputees who got landmine injuries.
Malaria is the biggest health problem since the establishment of the clinic. Many have lost their lives to the disease. However, other health concerns are also increasing as the population structure changes due to the movement of migrant workers.
We regularly monitor our caseload. So over the past 3-4 years, there are more malaria programs being targeted in this community because the malaria is one of the highest mortality, morbidity in this area, and also the drug resistant issue. There is more malaria targeted program, like malaria program coming from inside Burma, like from NGOs inside Burma, and also malaria program expand from the Thai public health. So there are more cases being treated in the community level. We have less malaria case than before, and we continue to see HIV, TB. These are the same problem, not better yet, because access to ARV or TB treatment is still challenging, especially for the migrant and displaced people.
Today, the main health problem in the area has changed from communicable diseases in the past to complex social problems. One of the hidden problems among the migrant workers is unplanned pregnancy caused by the lack of knowledge in birth control, leading to abortions. It is estimated that hundreds of babies in Massaud die from abortion each year. This is one of the complex problems occurring today.
The clinic also see higher proportion of women with reproductive age and many young, like adolescent boys, girls. So we do more reproductive health outreach program, partnering with other health facility or other NGOs or community groups.
Amidst the social and health problems that are becoming more severe, Metta Clinic continue to struggle to search for more cooperation from all sectors so that healthcare and aid continues. Dr. Cynthia admits that nowadays there are many challenging issues.
We could not expand much. Every year we have to expand, but we also have limited capacity. So we have to find a way how can we collaborate with other health facility. The major challenge is we still see the number more or less the same. The number is still not reducing. But we feel that currently with the political change, some changes in Burma, many international community start moving inside. So less funding available here. At the same time, the challenge is they are migrant workers, undocumented workers. So access to like health insurance, or because inside Burma we don't have health insurance system. But in Thailand also, many of them are undocumented or stateless, or so mobile, stateless, and displaced people. So like doing more proactive or preventive care service has become challenge.
Migrant workers' problems are more complex. That is, it is estimated that the birth rate of migrant workers in Thailand without access to education is more than 250,000, not counting stateless children of about 200,000 to 300,000. Various problems, illiteracy, inability to access education in Thailand or in their own culture due to their lack of legal status, has made their parents afraid of sending them to school. Other problems eventually follow, such as child labor and human trafficking.
For the migrant communities, it's very challenging because the parents doesn't have legal documents, or sometimes the parents move in a lot and then go to Thai hospital, Thai school. It is difficult for them. Sometimes the children come while they are 10 years old, 5 years old, they start working as a child labor. And sometimes the parents also move to another place, but there is no system for caring and support for the children.
As Myanmar and Thailand are neighbors, many problems inevitably affect Thailand. This is why Dr. Cynthia has established the Children Development Center, or CDC, to be the place where over 800 children of migrant workers have access to education, with the belief that without education, they may become a burden for Thailand in the future.
There can be more, not only the education and protection and healthcare. You need to work comprehensively. And again, before they leave the school, they need to have the skill and knowledge to work in the community, like language skill or some vocational skill, and access to better job opportunity for them as well. And then they also value the education, what they learn, and they can contribute back to the community or for the country, or Thailand or Burma.
As the land where the original clinic is built faced land rights problems and was sold without Dr. Cynthia's knowing, this will be the new location of the hospital, not so far from Mae Sot's city center. It will be soon that this new hospital will be opened to provide service to the disadvantaged. It has been almost 30 years of Dr. Cynthia's relentless journey, and not once had she wanted to give up. She has received 6 international awards, but she was never able to travel to receive the awards herself because of her refugee status, disallowing her to travel outside Thailand. But this has not made her feel weary at all. In the contrary, she remains high in spirit and determined to create good things for all the lives she has affected, for as long as they still need support from this woman of kindness.
So what we would like to see is people should have the same opportunity for education, healthcare, as well as they can be the part of the, not only the victim, the part of the victim of the conflict, part of the solution for the country, democracy, and promoting the peace in the region.
It is incredible that this great mission of being responsible to the lives of many others is in the hands of just one woman. The woman who has spent her lifetime as a giver without wanting anything in return. Or if there is anything she wants, it would be to see others have access to a better quality of life, living with pride as a human being, as everyone is born on the same earth. And that's all the time for ASEAN Connect today. We'll see you again next time. สวัสดีครับ